Colleen was 27, in between jobs without health insurance, when she discovered the lump on her breast. She didn't have enough savings to go see a private doctor, so she almost ignored the lump. But then she remembered Planned Parenthood. Colleen said if it weren't for Planned Parenthood, she wouldn't have gotten her diagnosis of invasive stage 2 breast cancer. She said she might not even be here today. Unfortunately, recent legislation to defund Planned Parenthood ignores women like Colleen. And women like Colleen could easily be me, or your mother, or your sister, or your best friend, women without the financial resources to have good access to health care. If you've kept up with any of the ongoing presidential election, you would know how determined many of our Republican leaders are to defund Planned Parenthood, which is a nonprofit organization and the nation's largest provider of reproductive services. I believe that the federal government should not defund Planned Parenthood. Tonight, I will discuss 3 primary reasons why. The first reason is that defunding would deny hundreds of thousands of low-income women access to important healthcare services. Now, I want to first clarify what is meant by defunding, because the government is not writing Planned Parenthood a check for $528 million in order for them to maintain their operations. The funding that Planned Parenthood receives from the government comes from 2 programs. The first is Title X, which is a federal family planning program targeted at lower income Americans. And the second is Medicaid, which is a healthcare program also targeted at lower income Americans. Now, 75% of the money that Planned Parenthood receives from the government comes in the form of Medicaid payments. And these are reimbursements for healthcare services provided, the same reimbursements that any other doctor or clinic receives for providing services to a patient with Medicaid. The defunding plan includes shifting the over $500 million that Planned Parenthood receives from the government to places like community health centers and hospitals. But this is a problem, according to Dr. Mark DeFrancisco, who is the president of the American Congress of Obstetricians and Gynecologists, because half of Planned Parenthood locations are located in areas without good access to health care. And this is why the Congressional Budget Office estimates that if Planned Parenthood was to cut funding, 1/4 of their 2.7 million patients would lose access to medical care. Why would we displace 2.7 million people into a healthcare system that doesn't have healthcare providers that can properly support them? Essentially, what they're trying to do is shift responsibility to places that don't exist. The second reason that Planned Parenthood should not be defunded is that Republican members of Congress are using defunding as part of a larger war against a woman's constitutional right to abortion. I'm sure many of you have heard about or maybe even seen the videos released this summer by the Center for Medical Progress, in which they secretly taped Planned Parenthood affiliates and claimed that they were illegally profiting from fetal tissue donation. However, several analyses of these videos, including one done by Fusion GPS, which is an independent research company, concluded that these videos were highly edited and do not represent a complete or accurate depiction of the events. Planned Parenthood maintains that these were edited to misrepresent events of safe abortions and legal tissue donation. These videos still sparked an outrage throughout the country, and they created an ongoing threat to defund Planned Parenthood, which is harmful to our society. To quote Senator Dianne Feinstein, who said, "The toxic rhetoric directed at Planned Parenthood is dangerous. It sends a signal that violence is a means to close clinics and to intimidate healthcare professionals. This is not okay." And this certainly rings true of the tragic event that occurred this past Friday at a Planned Parenthood center in Colorado Springs. A man entered the clinic, shot and killed 3 people, injured 5 officers, and 4 civilians. Now, I'm not saying that every anti-abortion activist would go to these extreme measures. Of course not. However, there have been at least 4 vandalisms of Planned Parenthood centers since the videos were released. Conservative uproar does not appear to be dwindling. But what they're attacking is 3% of what Planned Parenthood does, abortions. According to their annual report, the other 97% of their services are for things like cancer screenings, STD testing, and birth control counseling. And to be very clear, those 3% of abortions are not paid for by the government. For nearly 40 years, it has been illegal for federal funds to pay for abortions, except in the very restricted cases of rape, incest, or to protect the life of the mother. So despite evidence of the videos being highly edited and the fact that abortions are not being paid for by the government, the House of Representatives still passed a bill this past September to defund Planned Parenthood for 1 year. They're attempting to defund Planned Parenthood in order to reduce abortions and get one step closer to eliminating a woman's right to choose. However, that is not the case. And this brings me to my third and final reason that defunding would actually increase the amount of abortions. According to the Guttmacher Institute, who did a study in 2013 and estimated that Planned Parenthood helped prevent 870,000 unintended pregnancies and 345,000 abortions. And this is because 1/3 of all low-income women who receive publicly supported contraceptive care do so at Planned Parenthood. When you take away such a huge source of contraceptive care, combined with the fact that other healthcare providers would not be able to properly pick up the slack, you get more unintended pregnancies, which leads to more abortions. So if abortion is really the issue, defunding would be much more detrimental than it would beneficial. In conclusion, defunding Planned Parenthood is not defunding abortion. It's defunding women's health. Tonight, I have discussed how the defunding plan is part of larger efforts to eliminate a woman's constitutional right to abortion, but in reality, it would increase the amount of abortions while compromising the health of hundreds of thousands of low-income women. For myself, for every woman in this room, and for people all across our country, I stand with Planned Parenthood, and I hope you will too.